views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
And hello, everyone. Welcome to Open, the one and only show that opens the Bronx and the rest of the world right to you. I'm your host, Daren Jaime, and today we're going to update you on what's happening in and around our borough, as well as New York City, as we continue to deal with COVID-19. Coming up, New York State Senator Kevin Parker joins us. He shares a little bit about how tackling the coronavirus is making a difference in the hearts and minds of New Yorkers, as well as small business. Also, a little later on in the show, we'll sit with New York State Senator of the 32nd District, Luis Sepúlveda. He discussed how Bronx prisons are being affected during COVID-19 and its recent spread. And then after that, we're going to talk with Councilmember of the New York City District, Vanessa Gibson. She'll tell us about District 16 and the lack of testing centers for Bronx residents, as well as some initiatives that can be done to help the community. And then the New York State budget has officially passed, but we'll discuss the details about the budget and what it entails with Senator Gustavo Rivera of the 33rd Senatorial District. And he'll also share his thoughts on whether he feels Governor Cuomo is doing a good job. So stay tuned, because all this and much more is heading your way. Right now, we're officially open. And hello, everyone, and welcome to another edition, as we said, of Open. I am Daren Jaime. We want to thank all of you for watching, particularly here on BronxNet's Channel 67. You're watching Open, a live program that brings the Bronx and New York City straight to your TV sets. We also want to welcome our viewers on Manhattan Neighborhood Network, as Open is being broadcast live simultaneously on Eminence channels. Now you can stay connected to us on BronxNet's Channel 67, Verizon Fios Channel 33, or anytime on the web at bronxnet.org. You're also welcome to check us out on all of our social media platforms at BronxNet TV, where we will keep you up to date with the latest information. And although we're not in studio, we're definitely coming to you virtually to bring you all the news, the information, and the content that can help New York City become a better and a more safer place. Well, we've had a lot going on throughout the course of this past week. We'll take you through a few of those things with our Bronx updates. Well, BronxNet continues its coverage of the coronavirus and how particularly it affects New York City, more particularly right here in the borough of the Bronx. And on Saturday, April the 4th, New York State Governor Andrew Cuomo warned at his press conference the coronavirus has killed more people across New York State in a single day than it ever has before, and he fears the worst is still yet to come. New York City has more than 67,000 confirmed cases of the coronavirus, with the city's death count at more than 3,000 cases. The White House Coronavirus Task Force is now warning against going out to buy groceries or picking up medication in pharmacies, as the pandemic is expected to hit a deadly apex in the coming weeks. White House Coronavirus Response Coordinator Deborah Birx informed us, quote, "The next 2 weeks are extraordinarily important. With more confirmed cases happening in the United States, President Trump stated this will probably be the toughest week. Between this week and next week, there will be a lot of death. Unfortunately, quote, there will be death." Also want to report that New York State Governor Andrew Cuomo has issued a stay-in-place order. The New York's pause will continue till April the 30th. It was originally thought to take place or end somewhere around the beginning or the middle of April, but the governor extending it now till April 29th. Well, Governor Cuomo also issued an executive order, this one now, allowing medical students who are slated to graduate to begin to be able to practice to immediately help with the healthcare crisis. There are 85,000 healthcare professionals, including 22,000 out-of-state individuals who signed up to volunteer as part of the state's surge healthcare force. Governor Cuomo said, quote, "This pandemic has been stressing our nation on every level, and we're attempting to do everything in our power to prepare for the fight that will come at the apex." The state received medical assistance from Oregon Governor Kate Brown, who provided 140 ventilators. The state also received assistance from the Joseph and Clara Sy Foundation and the Jack Ma Foundation, which donated 1,000 ventilators and 1 million surgical masks, as well as 1 million N95 masks and more than 100,000 pairs of goggles. In other news, domestic and sexual assault survivors are trapped literally in their homes sometimes with their abusers, since the state mandated individuals to stay home. Our Bronx Net reporter Darissa Wright looks at this and brings us a story right now.
Since COVID-19 has forced people inside, home can be one of the safest places one could be amid the crisis, but not for domestic and sexual abuse victims. A record number 6.6 million people filed for unemployment benefits during the last week of March. In a study published by the Health Economics Research Group at the University of Miami, it found, quote, "The financial challenges associated with unemployment could increase tension, anxiety, and family discord, thus leading to increased alcohol use. And alcohol is suggested to be a contributing factor in domestic violence." Jocelyn Veliz is a counselor advocate for Violence Intervention Program and says that isolation increases chances of continued abuse.
Before they had excuses to go out, right? I'm going to go food shopping. I'm going to go for a doctor's appointment, school-related meeting or something, so they had ways of escaping home. Survivors are forced, for those who are living with their abusive partners, to stay at home. The abuse can happen in many different forms.
Veliz says the program has seen a decrease in calls to their 24/7 support line, but the silence could indicate an underlying issue.
We have actually seen a decrease in the calls, just because, again, this goes back to clients not having access to any way of communicating or reaching out for help.
According to a report by Politico, NYC Hope, the city's online domestic violence resource, saw a major increase in traffic to their website, over 1,200 visits in a 13-day period during the second half of March. Another concern could be that sexual assault survivors may think twice before going to a hospital to get a rape kit performed because of the shelter-in-place mandates. The International Association of Forensic Nurses issued a statement for sexual assault examiner nurses saying, in part, to communicate to patients seeking treatment, seek alternate care locations, and to strategize a plan for the increased number of patients during and after the stay-at-home orders. Jocelyn Veliz says the best thing to do during this time, if you are a victim of abuse, is to plan an exit strategy.
Planning with their friends or family, like a code word, right? If I text you the word red, that means reach out for help. I need help. And sometimes they don't even have any room available. And we just try to tell them, okay, even if you don't have the room, what is the safest spot that it's near an exit?
If you or someone you know is experiencing domestic or sexual violence, the Violence Intervention Program has resources available, including a 24/7 shelter. Reach out to the National Domestic Violence Hotline or contact RAIN. Reporting for BronxNet, Darissa White.
Thank you, Darissa. And BronxNet will continue its coverage of the pandemic and the coronavirus crisis and how it's affecting New York City. That's all the time we have for our Bronx updates. Stay tuned. We've got more show coming up right after this.
With coronavirus spreading, people at higher risk must take extra precautions. You're at higher risk if you're over 65 or if you have an underlying medical condition. Please visit coronavirus.gov for more information.
We continue our coverage of what's going on with coronavirus and how it's affecting Bronxites in New York City. Pleased to be joined by someone who has boots on the ground talking about how it's affecting his senatorial district and the members in his community. We're pleased to be joined by New York State Senator of the 32nd District, Luis Sepúlveda. Thank you, Senator Sepúlveda, for taking the time and being with us.
Oh, it's always a pleasure to be on your show, Daren, and I'm happy that you're helping get the word out, get information out, because during this crisis, that's critical.
Yeah, it is really a trying time, and I think even for Bronxites, we know that a lot of Bronxites, and we're seeing numbers continue to rise in our borough. Talk to us about what you're seeing in your senatorial district.
Well, there's a somewhat of a information based on zip codes. Of course, Jackson Heights, that area, Jackson Heights, Lower East Elmhurst, seems to still be the epicenter of the city. But I think a lot of that is because they were probably getting tested at a higher rate than people in the Southeast Bronx and places like near Tremont. Once more of the information comes out, more testing comes out, I think our numbers are going to rise dramatically. Unfortunately, a lot of it is based on health, the health care of the community and the density of the community. And in some cases where we reside in our district, it's a double whammy, where we have really dense areas and healthcare is either non-existent or poor at best. So I am praying that doesn't come to fruition. But right now, I just don't see how else it's going to happen once people get more testing and so forth. And there's been a lot of deaths, a lot of illnesses. Colleagues of mine, like Councilman Rafael Salamanca, who lost his father, Scott Stringer, who lost his mother. And you're going to hear more cases like that. One life that's lost is bad, but
Yeah,
it's just a real trying time for our country and certainly our county.
and I know also you're doing a lot of advocating for frontline workers. I mean, given the fact that there's a lot of hospitals as well as frontline workers who lack the necessary medical supplies. Hospital workers are really facing a lot of overtime during this crisis, and I know you have some concerns about that as well.
Oh, absolutely. I mean, my aunt is a retired nurse. She was a nurse for 44 years. And if anyone can explain to me the level of contact and danger that's involved, it's her. And she's told me that without the proper supplies, without the proper preventive measures, like simple things like N95 masks and the suits that help prevent the spread, that certainly that area, these hospitals, more people are going to get infected and more people are going to die. And look, there's no secret that the overwhelming number of people that are getting infected and are dying are seniors. But there is a percentage of people that are healthcare professionals that are relatively young that are also dying. And not just them, but people like, corrections officers. You had a few young men that were healthy that passed away. They don't have the necessary face masks or equipment that's needed. I mean, look, we've gotten better, certainly. Everyone is trying to help. I've been working with the Taiwan ambassador Shi, trying to get a significant number of masks to the city of New York. I have acquaintances that one offered 100,000 square feet for a temporary hospital. We could retrofit it for a temporary hospital in the Bronx. I know that Senator Brad Holloman delivered thousands of face masks to hospitals in New York City. I know that the speaker and Senator Jamal Bailey did a pop-up testing center in the Bronx, in the West Bronx, Co-op City. So everyone's trying to get the most that they can to help prevent this. And so we are certainly doing our best to protect people.
Let me switch from hospital workers to small businesses, because your senatorial district sees a lot of small business. We know small business is the lifeblood of America. And
Yes.
Given the fact that we're seeing a lot of small businesses strapped, closing their doors, and there's a huge possibility that some that have closed their doors may never reopen again. What's the plans that you're hearing, particularly for small businesses in your area, and how are you able to assist those?
Well, the federal government finally began taking things seriously and has allocated billions of dollars to protect small businesses. The problem here is from the very inception, the incompetence of the Trump administration. They knew as early as middle of January that this virus is a potential disaster, but he chose vanity and politics over taking preventive measures. I asked viewers of this show, why is it that South Korea, which was informed about the virus in the same that our country sometime in the early January, has only seen about 5 deaths. And yet we approximate that about 200,000 people are probably going to perish. And the president would call this a success and doesn't accept responsibility. For several weeks, I mean, he first referred to this as a Democratic hoax. He then downplayed constantly the potential impact. He took no affirmative steps other than closing the borders with China. But by the time he did that, the damage was already done. And time and again, he's played politics. He's denied New York the much needed supplies. He didn't take some of the tools that he has as president to make sure that he controls production. Before that, I remember he cut the National Security Council. He essentially gutted it in 2018. He cut the CDC budget by 20% to levels that we saw in the year 2000. And then when asked about it, he says, well, I don't take responsibility. My reaction is a 10. My rating is a 10. 200,000 deaths that were preventable. I don't think that's a 10. I think that's more like a -10.
Right. Yeah. A lot to really pay attention to when it comes to response from the federal government. Let me come from a state perspective, right? We know that you're dealing right now with the state budget and numbers and allocations. I know there was concern about Medicare and possibly Medicare cuts. Talk to me real quickly about the state budget, your thoughts, and even your concerns.
Well, we were fortunate enough, my colleagues in the Assembly and the Senate, working with the governor to make sure that the Medicaid budget, some of the funds were restored. We allocated about $4 billion to fight the pandemic at different levels. We were able to secure something that was very important to me, even though I had some issues with this budget because there were some things in there that I were gut wrenching, but we needed some funding, and $100 million were secured for hospitals that otherwise may have been cut. We also were able to restore funding for other things like, healthcare is beyond just going to the hospital. People have to have work, so paid sick leave. People have to maintain their jobs, so paid corona leave. We allocated funds for small businesses. We took affirmative steps within the budget that I think are going to relieve some of the individuals, not all, and anyone who says differently. This is going to impact our state and our country for years to come. But right now we have to focus a lot on medical issues. The Trump administration has talked about 2 healthcare companies that have waived the copays and are not going to charge people for treatment. But that doesn't impact those in the middle who don't have health insurance. And he has no plan to help these individuals. And when asked about it, he gave the mic to Mike Pence rather than answering himself, because the reality is he has no answer, and it's more a demonstration of his complete incompetence to the coronavirus and the impact that it's had in this country.
Yeah, well, we're definitely going to keep looking out and seeing what's going on in terms of districts and finding out what's happening. Thank you for updating us with what's going on in your district. Any final words before we leave? Yes,
Daren, my office is closed, obviously, because of social distancing, but we have been out there with Assemblyman Michael Blake and the Food Central Kitchen, delivering thousands of meals. And if anybody needs help, even though we're not there, we are accessible at 718-991-3161. We continue to do constituent services at record pace, and we want to help the community.
Yeah, well, thank you so much, Senator Luis Sepúlveda. Thank you so much for doing this interview and giving the Bronxites a little bit of what's going on. Certainly a lot of things happening in a lot of places and a lot of places being affected, and your district definitely one of those hot spots as well. Thank you so much for sharing with us.
Thank you for having me on the show.
All righty. Thank you. All right, listen, we've got more show. We want you to stay connected to us. Don't go anywhere. We'll be back with more Open right after this. Welcome back to Open. Daren Jaime here with you. We continue our coverage on coronavirus and how it's affecting not just Bronxites, but really all across New York City. Everyone's been affected. Hospitals are definitely at the front line in dealing with this. And our elected leaders trying to do their best to bring resources, awareness, and service to many across our city. Please be joined by New York State Senator of the 21st District, Senator Kevin Parker, who joins us now on the show. And Senator Parker, glad to have you.
No, thanks for having me. Good morning.
Good morning. No, and great to have you sharing with us, giving us a little bit of a well-rounded perspective. Talk to us a little bit about Brooklyn, your senatorial district. How is COVID-19 affecting your particular area right now?
Yeah. Well, again, let me just thank you for having me on, and I appreciate the opportunity to kind of talk to your viewers. I first want to just give my thoughts and prayers to the people who have lost folks to COVID-19. There's been a tremendous number of deaths across the state. A lot of them mostly of them in New York City, and so we certainly want to let people know who have lost people to COVID that we're thinking of them and share their anguish. But also want to give our thoughts and prayers to the folks who are suffering with COVID. There's some people right now who are in the hospital, people who are on ventilators, people at home, just suffering through these symptoms, and we're thinking about you and we're praying for you and hoping that you'll get through this soon. And then next, certainly want to give some appreciation to frontline workers, healthcare workers in our hospitals, nurses, doctors, people who are staffing the ventilators, pulmonary technicians, those folks who are making the hospitals run every single day, staff, administrators. We really want to let them know that we appreciate all that they're doing. And then, of course, essential workers that are out there, our police department, our fire department, EMS, people who are delivering every day for us, postal workers, UPS, FedEx, people delivering the young people who are delivering our food, Uber Eats, people are just making sure that we're being taken care of. And then, of course, the folks in the supermarkets who are making sure the supply chains are open, that we don't have a food shortage. For some people, that's the only way to get out. Maybe every couple of days or once a week is getting to the grocery store, and the fact that there's foods there. And so we want to thank those folks as well. There's a lot of bargaining units that are involved. UFCW, Local 1500, with our food. Our nurses, NYSNA, the New York State Nurses Association, 1199, PEF, CSEA, are all, delivering for us every single day. And then, of course, TWU Local 100 and the folks at the transit unit. There's a lot of transit workers who are getting sick. They're showing up to work every day. We want to thank them. The trains, the buses are still going, and people are showing up to work at great risk to their own personal health and their own personal safety. And so I just want to begin by acknowledging all those folks, because the city of New York still continues to run and still continues to be open. And that's not a feat, and that's not a small thing. That's really, really important. And then let me just say thank you to the governor and his staff. I've been talking to either the governor directly or to his staff every single day. And the members of the legislature have been, we're doing our job. Last week we passed the state budget. In the state of New York, we're the third largest budget in the entire country, about $180 billion. After the federal government and the state of California, the state of New York is the third largest budget. If we were our own country, Daren, we'd be the 8th largest economy in the world, right? This is not an insignificant amount of money. And the men and women of the New York State Legislature went to Albany last week, spent a number of days up there going through very long briefings to understand what was in that budget, to try to figure out how do we mitigate hurt to people. We came into this budget year already with a $6.5 billion deficit. We were asked to cut $2.5 billion out of Medicaid. We pushed a lot of that back. We did a lot of things in this budget to assist with the issues around COVID-19. We expect in the next fiscal year that we're going to be somewhere between $10 and $12 billion worth of deficit. And so there was a lot of really hard decisions that had to be made, and had to be made very quickly. But under the leadership of Senator Andres Stewart-Cousins, the majority leader in the Senate, and Speaker Carl Hastie in the Assembly, those decisions were made, and we had a budget that it's not great, but it's workable and it's balanced, and it was on time.
Can you give a little bit more in depth to me, a little bit about the legislation when it comes to protecting jobs? I think a lot of people are concerned about, of course, job security, and that's a major concern. Talk to us about the legislation concerning and protecting jobs.
Yep. When we first actually got started, about probably a little bit over a month ago, we quickly realized that this was going to be a problem for the state of New York, and the state legislature did two things. First thing it did is it gave $40 million to the governor in order to start fighting COVID-19. And then we also gave the governor a set of emergency powers so that we wouldn't have to keep coming back into session, and he wouldn't have to keep checking in every single time he needed to make a move around fighting this virus and this pandemic. And then what we did right after that was accelerate unemployment insurance benefits, so that people, oftentimes you have to be out of work 2 or 3 weeks before you could receive those benefits. We actually changed the law, expanded the number of qualifying positions that could get unemployment insurance, and then also made it easier and faster for people to get, so they could receive it immediately. And so we made sure that people received it immediately. We then, in our budget, have done a number of things around, emergency food and food pantries. Organizations like the Met Council are doing a lot of work in Brooklyn around providing food and providing services to people in poverty across the city of New York. Some specific things around, ensuring people's jobs, be honest with you, wasn't done. And I'm not sure that there was anything we could do about that in the specific moment. But we're looking at how do we mitigate the economic impact on folks. And so the governor put in a number of executive orders, one stopping foreclosures and evictions during a 3-month period, stop shut-off notices from utilities, so utilities, including your internet, can't get cut off during this period. And we're looking at how do we deal with, obviously people's mounting bills once this period is over. But right now, to be honest with you, we really were just more concerned about how do we get through this period. We're literally in the midst of the crisis right now, and wanted to make sure that we were going to get through the crisis the best way we can. We did get a significant amount of help from members of the federal government. And so I want to shout out Charles Schumer, my constituent, but our U.S. Senator Chuck Schumer, and Kirsten Gillibrand, and of course my congresspeople, Yvette D. Clarke, Hakeem Jeffries, Jerry Nadler, my brother Greg Meeks, all the congressional delegation, Adriano Espaillat, one of my former colleagues, all who made sure that they brought money back to the state of New York. The state of New York got about $11 billion from the 2 bills that were initially passed. $5 billion is going directly to the state to deal with COVID-related expenses. There is another about $4 billion going to rapid transit and the MTA in the state, most of that going to the MTA. And then there's $1 billion going to the city of New York directly for COVID-related activity expenses, and then about $1 billion going to other counties around the state of New York. And then in addition to that, wanted to acknowledge the hard work of Congresswoman Nydia Velázquez, who've actually who's contracted COVID. And we want to send our thoughts and prayers out to Congresswoman Velázquez, who has been very active on the issues around small business development. And it's in those 2 bills, there's $30 billion worth of relief for small business. And so if you're a small business owner, you should go on the SBA website. There are both loans and grants, and loans that can turn into grants that people can apply for to help bail out their small businesses. And so between that, unemployment insurance, and then the increased access to food resources, I think that there's some support there to help get us through the next couple of months. And not to mention the $1,200 check that many New Yorkers will receive as part of the stimulus, or I should say bailout that the federal government has done.
Yeah, well, before we get out of here, I want to get you one more question. You talk about all these things that are happening. Obviously, for New Yorkers, there's still some anxiety, right? And
a lot of
what's going to happen in the future? When are we really going to go out? What's going to be normal? What's going to be the new normal? So a lot of people have a lot of concerns. Give me your thoughts a little bit about managing this anxiety that we have, and what would you like to say to your constituents that in the city right now, given these times?
Well, the first thing is that we're going to get through this together. That's the main thing that people have to understand, is that we will get through this, and we will get through this together. And we have to just continue to work together to make sure that, we're taking care of ourselves and taking care of each other. One of the things that I really want people to do is, during this time is, first, facts over fear. right? Understand what COVID is about. Understand, how the disease is spread. What goes on. There's a lot of misinformation, a lot of conspiracy theories and stuff like that. And so people should only watch, kind of credited news sources. Be careful what you just click on Facebook and all that other stuff. Watch something that you is real news so you can understand. And don't spend all day watching the news. It's depressing. I don't do it. People should just, get away from that. And for me, I watch not more than an hour. I watch the governor's briefing and I watch maybe another hour of news, and that's it. Other than that, I'm kind of taking
ESPN is good during this time.
It is. In fact, I got off of First Take just to come and do your show.
Thank you, man. I appreciate it.
Yeah, y'all making me miss Stephen A. Smith, but I'll catch the end of it. But the other thing too is that if you feel like you're being overwhelmed, if you feel like this is too much for you, the state actually has a couple of lines, and one of them is a emotional support line. And so if you feel like you're being overwhelmed and you're feeling depressed, or you do your regular routine is being disrupted, call this number, 844-863-9314. Again, that's 844-863-9314. And if there's other information that you need as it relates to COVID-19, one of the things that the governor did with that $40 million we gave him was do a 24-hour hotline. And that hotline number is 888-364-3065. Again, that's 888-364-3065. And there's a corresponding website at www.coronavirus.health.ny.gov. Again, that's www.coronavirus.health.ny.gov. And I'll give you all the information that you need around.
All right. Well, Senator Kevin Parker, thank you so much, my brother. We got to leave it there, but definitely come on back and we'll have this conversation again.
Absolutely.
Continue to let the city know what's going on. In the meantime, you stay safe, and we'll get connected real soon.
Yeah, you stay safe too. And everybody, don't forget to fill out your census. 10 questions, 10 minutes, and the last 10 years.
All righty. Thanks, brother. Take care.
All right, take care.
All righty. Senator Kevin Parker, our guest here on Open. Stay with us. We do have more show coming up right after this.
With coronavirus spreading, people at higher risk must take extra precautions. You're at higher risk if you're over 65 or if you have an underlying medical condition.
And welcome back to Open. Daren Jaime here with you as we continue our coverage on coronavirus and how it's affecting New York City and particular districts. We're pleased to be joined by a very special guest right now who will share. She's actually coming to us live, and she is actually working in her district, delivering food. None other than council member of the 16th district, council member Vanessa Gibson. And good to have you.
Thank you. Good afternoon. It's good to be here. Sorry I can't see you in person, but that'll happen soon.
Yeah, well, it'll happen soon, and we're doing it virtually. But in the meantime, it's good to see you and good to be with you. Talk to us a little bit about this, because you're out there having food distribution for the community. Talk about what you're doing right now.
So for the past couple of weeks, obviously dealing with this coronavirus and the fact that every day it seems like there are more positive cases, more hospitalizations, and unfortunately for us in the Bronx, more Bronx deaths. And it's really alarming. And as the council member of District 16 in the West Bronx, it's really been overwhelming to try to coordinate all of the services with multiple city agencies on the ground, making sure that our schools are open for grab-and-go breakfast and lunch for children and families, making sure that seniors are taken care of as it relates to home-delivered meals and health and wellness checks, making sure that residents in public housing are good, working with housing authority, and working with the mayor's office. It's been a lot of coordination. I've never been on more conference calls and video conferences in my life, because
Right.
That's the way we have to talk. So it's every hour talking to commissioners, deputy mayors, the mayor's team, talking to the governor's team. You know, honestly, the reality that we have faced in the Bronx is access to food, healthcare, and testing. Testing sites have been coming online across the 5 boroughs to alleviate the overburden of hospitals, right? So looking at sites adding additional capacity like Jacob Javits, looking at New York Expo where you have additional hospital beds, right? Where you can take residents that are hospitalized with non-COVID cases out of the hospital so that the hospital staff can focus on those that are hospitalized with COVID-related illnesses. And then the other issue are the testing and assessment sites, looking at how we can use our H&H public hospitals, Jacoby, North Central, Lincoln. But in addition, for those of us in Highbridge and Morrisania, which we saw the DOHMH data just last week, the highest rate of hospitalizations are concentrated in areas of Morrisania and Highbridge. And we know that's for a reason. The underlying issues of heart disease, of diabetes, and asthma is real for us in the South Bronx. We've been dealing with this for decades. So we understand when our residents are hospitalized, your lungs are compromised when you have asthma. And so the reality is our people are dying. They're being hospitalized, but they are losing their lives to COVID-19. So yes, we want to talk about more assessment and testing sites because people that have symptoms are worried. They can't get tested and they're at home self-containing themselves, but we're discouraging them from going to the emergency room, but they still need help. So I've been saying to the administration, let's focus on our clinics, our local community-based healthcare centers that are already open and operating on limited hours, but there's a continuity of services. Our residents sometimes go to emergency rooms for emergencies, but they go to their local clinic for regular checkups. So we should be working with those medical professionals and coordinating services for them, getting the equipment, the personal protective equipment, the masks, the gowns, the gloves that they need, but allowing them to do some of these services so we reduce the burden on our hospitals.
Right. I want to get more specific because when you talk about communities of color, and that is a conversation that's being had, but not really being vocalized too much. We know that there in communities of color, the chronic diseases mostly occur in communities of color. Secondly, we also know that as you pointed out, the Bronx with the high rates of asthma, the high rates of these other diseases are actually right in your pocket. But yet and still, when it comes to testing, it doesn't seem like the testing sites are actually in good proximity. Can you share a little bit more about that? Because if I'm sick and I'm in your area, I may literally have to take a bus or some form of public transportation to get there. And if I'm correct, I think that puts more people at risk.
Right. And that's been the challenge. We've been coordinating with both the governor's office, who really oversees all of the drive-through sites, like we have at Jacoby Hospital. There's one at Lehman College in the parking lot. There's one up in Co-op City behind Bay Plaza Mall. Those are sites that were identified and coordinated and really overseen by the governor's office and his team. The city's testing and assessment sites are really at health and hospital locations. Those are public hospitals. But for us, the only public hospital we have is Lincoln, which is doing assessments and testing. Just today, we learned that there is a new site for assessment and testing at the old Morrisania Diagnostic Treatment Center at 1225 Girard Avenue. That's between 167 and 168, between 8 a.m. and 4 p.m. They're doing it in shifts for the public as well as first responders, medical professionals that want to get tested. But I've been saying, I appreciate that. Thank you very much, but it's not enough. What about Highbridge? What about a whole neighborhood on the hill west of Yankee Stadium that's isolated, that has nowhere to go? So we've been pushing. It's obviously the city and state that have to do this. So looking at some of our excess parking lots along the Harlem River by Mill Pond Park, right next to Yankee Stadium and the Major Deegan, there's a lot of parking over there, and no one's using it today. That's usually for fans that come to Yankee games. No one's using it. They're empty. And we ultimately could use those parking lots as a drive-through site, right? For anyone in the West Bronx, they can get there. But I also think we have to pay attention to Highbridge because the numbers are alarming. And we know that while we have documented cases, I'm more concerned about the cases that have not yet been documented. And because we don't have race and ethnicity, we know that this disproportionately impacts Black and brown communities at the highest level.
Yeah, we're seeing that in Chicago. We're seeing that in Michigan. We're seeing that actually across in several pockets around the United States. In the state of Chicago, city of Chicago alone, 70% of infections, or I should say deaths, are actually occurring in African-American communities. So the numbers are, the numbers are alarming. Give me a little bit about Yankee Stadium and the Yankees. Have you had any conversation with them in terms of saying, listen, we need to use some of your area possibly, and seeing about that partnership?
Yeah, so we've been in conversations with the New York Yankees, and a lot of the excess parking lots along 153rd Street, along River Avenue, along the Harlem River are owned by Bronx Parking Management, which is a private entity that we've been working with around just accessing these parking spaces for local residents during the non-baseball season. So there are conversations happening. The challenge is that I think in the past with some of the drive-through sites, they have not been as successful as we want them to be. It's a lot of work. It's a lot of effort. And testing, as I understand, takes up a lot of personal protective equipment. There are certain regulations you have to follow. It's a lot of wear and tear on staff, right, for assessments and testing. There's a certain distance that you have to have with patients. So it is a lot, but I think it's important and it's warranted because the reality is people are being hospitalized and they're dying. So I appreciate the president, the governor, the mayor, all talking about more ventilators and looking at excess sites for additional hospital beds. That's going to be a great thing because people are hospitalized right now with non-COVID related illnesses, but they're in the same space as someone that has COVID. And that's dangerous and it's very risky for them, particularly in the Bronx. So there's going to be some more push. Elected officials from the state, my colleagues, Assemblymember Latoya Joyner, Michael Blake, Gustavo Rivera, Luis Sepúlveda, Marco Serrano, we're all in communication, putting together letters, and we're going to do some pushing to the governor's office about drive-through sites, as well as the city on some of the city property that we own and we control so we can get more testing, drive-through, but I also want to get our clinics and our healthcare centers involved too. I don't want to forget them.
I don't want to leave this interview without asking you this last question. Talk to me because you've got healthcare sites, you've got hospitals that are in your district. Talk to us about what are you hearing from frontline people as to the needs and the gravity of the situation right now?
It's a nightmare. I've talked to folks who work at Montefiore, at Barnabas, at Bronx Care. It's alarming when you hear about morgues being overcrowded, when you hear about funeral directors that are working triple overtime. It's alarming. People are dying at such an alarming rate, and it's nothing that we've ever experienced before. I think people are filled with anxiety. They're frustrated. They're angry. They're depressed. It's a lot of wear and tear on your body, your mind, and your soul that you have to wake up every day and do a job knowing that people are going to die. But I think New Yorkers are resilient. We have been through a lot of challenging times before, and we all know we're going to get through this. There are going to be some bumps in the road, right? I always say there's setbacks, but setbacks are preparation for a comeback. And people need to adhere to social distancing. They need to stay indoors, only go out for essential services, because there are tons of people that are carrying the disease that don't know. And they may or may not have symptoms. And that's why we tell you to make sure, look, you have your mask, right? You have your gloves, because it's important. You are 6 feet away from someone. So I think people are anxious. They're nervous. They don't know when this is going to end. The idea that we can't go outside, we can't go to the local park is frustrating. Children are in their homes every day, and it's a lot. Families are in their homes. I mean, we at the city council are looking at some of the other underlying issues that will result as a result of COVID, like domestic violence, right? Where you have, intimate partner violence. You have couples that are trapped in their homes, that have nowhere to go. They don't want to go to a shelter. They can't live on the street, but they're in a situation that's not safe for them. And they're more likely to not report right now. Those are the things that we're thinking of, because we know it exists, but it's hard to reach those households where people don't want to come forward. So I think when you talk to the medical professionals, the frontline staff, everyone is going to complain about lack of equipment and resources. They're going to talk about overcrowding emergency rooms, patient after patient, and the continuity of care is what's going to be lacking. Like, you are a patient, but I got to get finished with you so I can get to the next one and the next one and the next, and it's like that every single day in our hospitals. So we give a lot of credit. We sometimes think that all heroes wear capes, but I tell you, all of our heroes are wearing doctors' uniforms. They're wearing, police uniforms. They are nurses. They got scrubs on. They got gloves on. They're in the supermarkets. They're in our schools, giving out food. These are our heroes and sheroes. And I think sometimes when we go through these challenges, you are reminded of some of the everyday heroes on the ground that are doing this work anyway without any recognition. And so we got to pray for them. We have to pray for their strength, because a lot of times we feel weak, like we want to give up, but there's too much at stake, too many people dying, and it can happen to anyone. This virus is not discriminating. It can affect any and every single one of us. So we have to understand, when we are giving guidelines, we have to follow them. We have to check in on neighbors and family, those that are medically frail, that may be homebound. I'm hearing about cases of seniors that were found dead in their apartments because nobody checked on them. Like, we can't have that. We've got to check on people that we normally don't hear from.
All righty. Well, we got to leave it there. Councilmember Vanessa Gibson of the Councilmember District 16. Thank you so much. As you're out there, stay safe. Continue to give us the information. We definitely want to follow that about the testing sites and seeing about what we can do about raising our awareness, raising the voice about getting those testing sites in better localities. Thanks so much.
Yes, we'll stay in contact. When we send letters out, we're working on a letter now, but we'll make sure you get copies of that. We got you.
Okay, then. Councilmember Vanessa Gibson, we leave it there. We got to take a quick break here on Open. We'll be right back right after this. We're back here on Open. Glad to have you sharing with us. And as always, we continue to bring the news, the information, and the content that you need to have, particularly in a season such as this, as New York City and the state really tries to navigate through COVID-19. We've had a variety of different guests on our show, and we're glad to have this very special guest sharing with us too. He comes to us out of the 33rd Senatorial District here in the borough of the Bronx, New York City. None other than Gustavo Rivera. And thank you so much for being with us and sharing with us, State Senator Rivera.
A pleasure to be here with you.
Yeah, so let's get right at it. We know the governor's extended the pause through April the 30th. Your thoughts, first of all, on the initial move by the governor?
Well, I believe that the period is up until April 29th, but it doesn't matter one day on or off. We're talking about the rest of April. That's the right thing to do. And I understand that people are, many folks have already been inside their homes for a couple of weeks. They're getting a little bit stir crazy, and they're trying to figure out what's going on or what's not going on. The reality is that this is not something to be messed with. We have to look at places like Hong Kong and some places in China where they kind of took the foot off the gas a little bit too early. The reality is that this is something that is incredibly contagious. It is deadly for a large chunk of the population, and even if we're talking about 1%, and in the state and in the country, actually, we are hovering around 3% nationally. That is incredibly serious. We need to take it seriously, and it's going to have an impact on our lives. But we are better off doing this because we want to keep our lives, and more importantly, the lives of our loved ones, people who are high risk. Are older people that have diseases which make their systems compromised, or folks with respiratory illnesses. And when you think about the Bronx in particular, the Bronx, with the health of people in the Bronx, we've talked about this many times on your show, about the fact that the Bronx is the unhealthiest county in the state. We are seeing the result of that. When you're talking about Bronxites, we are 3 more times likelier to die in the Bronx than we are if we lived in Manhattan, and that's during this crisis. We can't ignore that. So we should stay home. It's going to be an impactful month. It's going to be difficult, but we need to do it to make sure that we can be healthy at the end of it.
Yeah, let me balance this out with another topic of conversation, talking a little bit about impact, right? The Medicaid budget cuts we're talking about, and the budget itself. Your reflection on the budget. I know it's hard. I know that the governor's talked about New York is near bankrupt and a budget had to be in place and passed. Your thoughts on the budget and also particularly Medicaid?
Well, I'll tell you, when we think about the governor in the last month, and we compare it specifically to what's happened at the national level and the fact that the White House has been beyond incompetent, a lot of people look at the governor and said, there goes a common sense guy who is doing the right things. And just in the last couple of days, a matter of fact, he said it today as well in his press conference. He said, we can't attach a dollar figure to people's lives. And tragically, that is exactly what the governor did during this budget process. Now, it was, when we're talking specifically about Medicaid, of course, it's a public health, it's a system that takes care of 1 out of 3 New Yorkers. And it is a system that was already very much at risk even before the crisis hit, and it takes care of our most vulnerable populations. He insisted, he demanded that we cut that system by up to $5 billion for this coming year. Now, we were able to push him back a little bit, but it's still going to be about a $4 billion cut to a system that is already stressed. I think that what he did was immoral. It was a callous move. This is the wrong time to cut this system. I don't think there's any good time to cut a public health system, but in this particular moment, it's even a worse decision. And lastly, what he is asking us to do, when he asked us to do in the legislature, was to give him the authority to cut a system which is already, again, as I said, teetering on the edge. The people, as we see right now in the Bronx, there's a lot of Medicaid patients in the Bronx because we have a lot of poor and working class people in the Bronx. I already said that we are at a higher rates, that we're dying at higher rates than the rest of the state. And that's going to be the reality in all poor communities of color. And those poor communities of color are served by this system. So the idea that he would cut it and that he would not tax billionaires and millionaires at a higher rate so that the hit would be lessened. It's just something I cannot and I will not be silent about what the actions of the governor have been, and the fact that the system that is going to keep our most vulnerable healthy and alive, and it's going to do so with an incredible stress on it immediately after the crisis is done, is going to get an enormous cut that this governor pushed through. That is immoral, callous, and I could not vote for it.
So let me go through the reasoning why. I think a lot of people are asking the question, why were the cuts to Medicaid necessary? Why
weren't,
especially given this time?
I don't believe that they were. Listen, we can have a conversation about what he said at the beginning of this year. And I have been fighting with him on this issue on Medicaid since the beginning of the year, because even before the crisis, he proposed something called the Medicaid Redesign Team, or MRT. This was something that was done back in 2011 when the cost of Medicaid was shooting through the roof and we needed to kind of manage it. And so I certainly believe that if we're going to identify fraud and inefficiencies, that we should do that. But unfortunately, that is not what he proposed to do. Take St. Barnabas, for example. St. Barnabas is a hospital right in the middle of my district, serves over 90% of the people there are Medicaid patients. And it is a hospital that's been consistently at risk for the entirety of my tenure, right? 10 years, I've been in the Senate, and for 10 years, they have been struggling and making sure that they continue to be an incredible part of the community. What he proposed originally was to cut it by $9 million, which would have been disastrous to that hospital. We were able to fight it back. We still don't have clear numbers about the impact that it's going to be just on that hospital. But you have, if we're talking about hospitals, we're talking about nursing homes, we're talking about people in long-term care, we're talking about folks in our families and in our communities that need this care. If we're going to talk about inefficiencies, and we're going to talk about making sure that we can do the right thing with the money, I believe in that. But first of all, I believe that this is not the time to cut our way into making the system better. It needs to be a more inclusive process of people who are actually service providers, because that MRT that I described did not include a whole bunch of people, like health and hospitals, the public hospitals in the city of New York. They weren't at the table. Doctors weren't at the table. Nurses weren't at the table. Federally qualified health centers weren't at the table. And they're all going to be impacted by these things. So if he wants to get rid of fraud and inefficiency, fine. But let's do it at a time when we're not in a crisis. And for the love of God, if we are talking about cuts, could we talk about taxing wealthy individuals, millionaires and billionaires, at a higher rate so that the hit would be less on working and poor people across the state? He didn't choose to do that. This is choices that the governor has made. And we need to make sure that regardless of how good he looks in comparison to that orange madman in the White House, we can't forget that these are actions that he has taken, and we need to hold him accountable for them.
Understanding. Before we leave, let me talk to you about services in your area real quickly. For those who are in your area worried about services, particularly seniors and those who are the most vulnerable, what's available and what would you like them to know before we go?
Well, first of all, my office remains open. We are operating remotely. My team is available to you. I hope that you can put the number underneath, and that is 718-933-2034. Now, my office is operating remotely. That number will connect you to one of my staffers, and we're open to help you in any way that we can to connect you with services. As far as everyone else, I tell you, look, our healthcare system has been put under stress. Unless it is absolutely necessary, stay at home. There's a lot of times, a lot of folks in our community might use emergency rooms or urgent care centers as a way to kind of deal with their medical issues. For the moment, stay at home unless you absolutely need to, because every person that is in the system puts further stress on it, and we're already operating in a very, very tough place. But ultimately, this is what the message that I want to leave you with. I'm not from the Bronx originally. I was born and raised in Puerto Rico. I came here in 1998. That was 22 years ago. And the reason I fell in love with the Bronx is because of the resiliency of its people. When we think about the fact that at the end of the 70s, during the 80s, and certainly all the way up until the 90s, the Bronx was not necessarily a place where a lot of other people wanted to live, but you had Bronxites who had remained here during generations because they believed in this place, and they kept building even when other people ignored it. So I believe that is that resiliency that is going to get us through it. We have a diversity and we have a resiliency, which is what I've fallen in love with, which is why I'm a proud Bronxite to this day. And I would ask every one of your listeners and your viewers to hold on to that. It is going to be difficult. It is going to be terrible, but it is not something that we haven't seen before. I believe that we can get through this Bronx strong every single day. I believe it.
We believe that too, and that's what we're gonna get through this together. And so, Senator Gustavo Rivera, thank you for taking the time of sharing with us here on Open. We want to continue to stay connected to you as you continue to give us information.
Well, I'm not going anywhere. You need me, you know how to reach me.
I don't think any of us are right now. Stay
exactly.
Senator Gustavo Rivera. All right, listen. Thank you, Senator. And we also want to thank the viewers for tuning in, because guess what? We're out of time for today's show. Want to thank the guests and also the viewer for you tuning in. Now, if you missed any part of today's show, you can catch the Recablecast at 5 and 10 p.m. on Bronx's Channel 67. If you have Verizon Fios, that would be Channel 33, or anytime on the web at bronxnet.org. For all of us here on Open, as we continue to do it virtually, bringing you content and information, be safe, stay indoors, and most of all, keep this channel wide open, because we do have information that is valuable to you. Daren Jaime saying take care and God bless.